So now we move on to something else, Malcolm.
Indeed. Well, this morning we're going to jump right into the conversation, and we have the privilege to have in our studios in Abuja the Minister of Health. He is the coordinating Minister of Health in our Abuja studios. Just one moment now. And well, Honorable Minister, I ought to have been in Abuja with you, but for circumstances beyond our control this morning, I'm having to talk to you from Lagos. I'm hoping that we can make this conversation as seamless as possible. But Dr. Ali Pate, it is, and Professor, as a matter of fact, Absolutely. Ali Pate, thank you so much for joining us from our studios in Abuja this morning. It's good to have you with us.
Thank you for having me.
Well, before we go on in the conversation, Malcolm, there's some kind of a background you need to see so you understand where we're coming from and where we're going in this conversation.
2024 ushered in a huge increase in the prices of medication and pharmaceutical products. And one of the first tasks on the Health Minister, Professor Ali Pate's plate, was a meeting with pharmacists and pharmaceutical companies where he promised to sign an executive order which would help the situation.
Oh wow, has the situation improved? Well, if the reference point is cost of medication, one can say it has not really improved significantly. And the reason for that is not far-fetched. One, the executive order promised had come in terms of what we have on paper, and that executive order details certain things that should really bring relief to the industry. For instance, 0% import duty, not only on machineries, not only on raw materials, but even on finished product for a period of time.
From January up until the end of September, there were almost 11,000 suspected cases of cholera in all 36 states in the country and 359 deaths. Lassa fever was an ongoing concern throughout the year, with 191 deaths from over 9,500 cases, most of them from endemic areas like Bauchi, Ondo, Taraba, Ebonyi, and Enugu states. On the bright side, Gavi, the Vaccine Alliance, donated 846,000 doses of R21 malaria vaccines in the first instance to the federal government as an adjunct to other proven methods of reducing the malaria burden. Also, as part of efforts to mitigate the spread of Mpox, which the World Health Organization had declared a public health emergency of international concern, the United States Agency for International Development, USAID, donated the first batch of 10,000 Mpox Jynneos vaccines to Nigeria. Nigeria also became the first country worldwide to introduce a groundbreaking WHO-approved 5-in-1 meningitis vaccine, MEN5CV, with the potential to reduce the case fatality from the current 50%. According to the Minister of Health, more Nigerians enrolled in the National Health Insurance Program over the past 1 year than any single year since the program began.
We've seen more than 10 million Nigerians receive critical services in these primary health care centers over the last 1 year. We've seen increase in essential care. We've also seen increase in skilled birth attendance. We've seen more than 2.4 million Nigerians have now been covered by health insurance, bringing Nigerians
or a reduction in our environmental practices. In the local government administrations, back in time, and I'm sure you probably remember it as well, we had very active environmental officers who went around to ensure that they prevent a breakdown of health, a breakdown of diseases, epidemics, endemics, whatever it is, in many of the localities. But it would seem that these days we hardly hear of those things. That is why for so long we've been talking about Lassa fever, and we're still struggling to take down Lassa fever simply because we are not able to take care of the rats that cause Lassa fever all through the years. So How is that collaboration happening when the Ministry of the Environment at the various levels of government in the country are not able to deal with the environmental issues that cause these national health disasters?
This is a very complicated question. And I will, first of all, on Lassa fever, I will say that on 15th of January this week, we're hosting a regional conversation on the Lassa fever vaccine development. And Nigeria is leading in the West African sub-region, a consortium of countries doing studies and with a view towards introducing a Lassa fever vaccine over time to solve this issue. And we can invite you to come and listen into this interesting conversation that we're having. But on the issue of the different actors that need to play, health is a very interesting sort of construct, because the health of a population, there is what government does, but there's also what individuals and households and communities do that influence their health or not. So if there is a measles outbreak in a local government somewhere in this country, because population did not immunize their children, whose responsibility is it primarily? Is it that of local government that didn't have the primary healthcare system? Or is it the states that have not enabled it? Or is it the federal government? But if you don't deal with it, it can move from one local government to another local government and threaten that local government. So there are externalities. That is why all actors need to come together. But in fiscal federalism, the states and local governments have their degree of autonomy. So what we are doing is constructing an arrangement whereby we've got an incentive mechanism and advocating and really showing the path, providing the data, setting the direction, trying to hold all of us accountable. That's why we have performance dialogue. That's why we had a joint annual review, the various scorecards for each state, so that state governors and local can look at it and say, look, okay, how am I performing relative to my peer? There are some states that are performing at a third of what their peers are performing. So that's an incentive for them to do more, because the public can ask questions. So instead of asking the Minister of Health, you can ask the state government, what are you doing on primary health care, or the local governments? But on the positive note, I will say that we met with the local governments through the Association of Local Governments of Nigeria. They're very keen, they're very willing to engage in this vision of the president to transform a health sector. And with this autonomy, they are really eager to contribute their own part to the degree that they have these resources available to them. And I know that the state governments have done so well in terms of shoring up, complementing with the federal government to ensure that the progress that we're making, we do it all together, and we will continue in that direction. So instead of dividing into pieces, what we're building is really coherence and collaboration and cooperation between different levels of government. And that is the way to improve population health outcomes for Nigeria. Then there are other determinants outside the health system. You mentioned environment. That's important. I'm very fortunate that my previous colleague, the Honorable Minister of State for Health, became the Minister of Education. Education has an important role in maternal mortality, in immunization, because uneducated mothers have the bulk of zero-dose children and the children that are not immunized. And the human resources requires a good educational system. But my new colleague, the Minister of State for Health, came from Minister of Environment, and then that connection with the Ministry of Environment and my colleague, the Minister of Environment as well, is there, so that we work collaboratively. Ministry of Women's Affairs has an important role in health. Minister of Water Resources, in terms of cholera, much of what we did, and I saw in your report, that Nigeria faced a cholera outbreak, but a cross-sectoral group was assembled by the president to see how we deal with it, because water, sanitation, and hygiene is as important in dealing with it. And of course, even defense and security. In some areas of our country, insecurity limits the ability of vaccinators to immunize children. But the defense and the military and the security services can play an important role. So it's a cross-sectoral effort, not just a narrow biomedical one, that is needed to improve population health outcomes. Because at the end of the day, it's the person. We're not building a health system just for itself. We're building a system that will serve the people. And to improve their health and well-being, they need nutrition, they need water, they need housing, they need sanitation, they need women to be empowered to take their children, and they need the services, whether it's reproductive health, whether it's immunization, and when there are complications, they need to afford to go to higher levels, and when they have the unfortunate circumstances of things like cancers, they need to have higher level services, the tertiary hospitals that are equipped to be able to diagnose them and to treat them. That is the vision that we have in the health sector that I think is in line with the President's renewed hope agenda that we are driving towards.
And I guess it's very much in line with the title that you carry, which is larger than just health, and the fact that you are coordinating minister, and I guess that it's all encompassing. You're not just looking at health, you're also looking at social welfare. I was just going to ask you, before you elaborated a bit more, to speak on the social welfare component of the ministry which you're currently heading. How are you able to measure if you're actually having an impact on overall welfare of Nigerians?
I think it would be presumptuous to think that one sector or one institution can have direct responsibility or impact in the overall welfare. The entire business of government is geared towards improving the welfare of Nigerians, whether the federal government, states, and local government. In the federal government, there are many institutions that play an important part in the overall welfare of Nigeria, whether it's the aged, whether it's the young, whether it's the service chiefs or the police or other services, whether it's the agriculture. There are many facets of it. The way we look at it, health is a component of social protection, because lack of access to health can undermine a family to move more into poverty. If someone is not able to go to market, go to their workplace because they are ill, or go to trade, open their shop, and they eat day to day, they can be tipped into poverty because of ill health. So all these investments that can protect a population from ill health are in a way protecting them from dipping further into poverty. When we provide the Vulnerable Groups Fund with resources to the basic healthcare provision mechanism that is with us, we are also ensuring financial protection when folks experience illnesses, when they face catastrophic health expenditures, to provide support for them. We're now advocating for more to be done, and in fact calling that we should do more through NHIA to set up a catastrophic health insurance fund for those who can be tipped into poverty because of major health expense. That's social protection. When we protect against outbreaks and respond to them, we saw how Ebola did it, we saw how COVID, health conditions can interrupt economies and lead to serious economic damage, as we saw with COVID. Almost 5% of global GDP dipped down, and many countries are still struggling to recover from the impact of that health. It is a virus that caused a major global shutdown that we had never seen. So how do we protect that? And that's why we have a pillar on health security. So we see the social welfare as a set of interconnected interventions that have to be delivered, and that health is a core part of that. Part of Nigeria's effort to provide social protection. But there are other elements, whether it's insurance, labor market, that also have to come into being to improve the welfare of Nigerians. And we'll do our part and expect that others will also do our part. Then the overall objective of government on the welfare of the people can be enhanced. That is what we're trying to do.
Honourable Minister, one will acknowledge the investments that have been made in recent times. I mean, you've spoken about the cancer centers, and I have had the opportunity to speak with the one of the, will I say, is it the executive directors of the cancer center in Maiduguri, and also at the university there, the University of Maiduguri. They are very proud of what they have established in Maiduguri, especially with the cancer care, and it all comes complete with 24-hour electricity, which has also been thought about. So it is comprehensive indeed. However, personnel continues to be a challenge. Overall experience of Nigerians when they go to the hospital, as you and I, as we are all having this conversation in our studios, Nigerians, some Nigerians will certainly be at government hospitals this morning, hoping to access health care. For those who are at federal government-owned institutions, how are you hoping to improve their overall experience? Because for a number of people, it's not because they don't want to go to healthcare centers. They dread the idea of having to go there because they know the hassle it's going to take for them to be able to, get services. How are you working to improve the experience of the everyday Nigerian who has to use a government hospital, particularly federal government-owned institutions?
So the health system is integrated. So the defragmentation we're trying to do, if the basic conditions are attended to at lower levels, at the primary care and secondary care, the more complicated cases can go to the specialized centers, the teaching hospital, tertiary institutions, they can be attended. If you go to many of our federal tertiary hospitals, you'll find cases that ought to have been dealt with at lower levels, but have filtered up and added to the burden of care. If you're a consultant physician, there are some basic things like treatment of simple malaria that shouldn't occupy you. You should deal with the more complicated cases, high-training infectious diseases. So if you have a basic pneumonia, if I treat that case, it's just misallocation of time and resource, because I should be treating more complicated pneumonias that have not been well treated, and they have, or the diagnosis that has not been well. So that's the idea of having the functionality of the lower levels of the healthcare service, so that the more complicated cases get to the federal facilities, while we're expanding the federal facilities and the capabilities of the health workers and their working conditions. I have to tell you, we're just in day 11 of the new year, and I had the privilege again of briefing His Excellency Mr. President this year on the health sector, and touched on important issues affecting the well-being of the Nigerian health workers. And I know that he cares about it very deeply. After all, he's the African Union champion for health, human resources, and community health delivery. So we are working very hard to look at what other ways we further enhance the experience of the Nigerian healthcare workers, because they are very committed individuals across all levels. We're working sometimes in difficult circumstances in our federal facilities, but also outside them, so that we collectively try to improve the experience of Nigerians when they interface with the healthcare system. We are not there fully yet, and it takes time, but we're on that journey, and we're committed to seeing it through.
This challenge which you mentioned, the fact that, diseases that ought to have been treated at primary or even secondary healthcare levels always, people present them at tertiary institutions, has been there for a very long time. And I remember, I think it was the former governor of Lagos, Babatunde Fashola, who always highlighted that, the primary health care centers had to work as a result of that. But I don't think that would have stopped people, from taking common cold or even malaria to, tertiary institutions, tertiary health institutions. Knowing that has been a challenge, and it is something that is burdening the tertiary healthcare institutions, has there been something in place, a plan in place to maybe differentiate what it is that people are presenting? Is there a way to do that? I'm just curious. I've just been wondering if there's a way to actually say, how serious is your condition? Maybe you should go to this healthcare institution instead of coming to, say, Luth, that's the Lagos State Teaching Hospital, for instance. I'm just wondering, has any thought been given to separating what is really serious, what tertiary institutions should be dealing with, from what, secondary or primary institutions should be dealing with? A reference letter, for instance, used to be a referral letter, as they say. But it does appear that is no longer the case, is it?
So I think we've been discussing largely on the public side. Mind you, there are important service providers also on the private sector side who provide a significant portion of the healthcare services the Nigerians need, whether in the front end routine care or specialized services through the private sector. And we need to also keep an eye on that, so that Nigerians are able to afford them, but the quality, and they're able to regulate them so they do no harm, but also enabled to thrive, and there are providers committed. But in the private sector, like most countries, we have a mixed healthcare system. In our own side, when it comes to public resources, What we're trying to do is to improve the allocative efficiency. It is allocatively inefficient if complicated cases are crowded by very basic cases at teaching hospitals. So getting the primary healthcare system to function, what I mentioned earlier in this conversation about the foundational nature of primary healthcare, is not to diminish it. It's so foundational because if it functions and people know they can go to their neighborhoods and get seen within an hour and they're in and out and have their malaria, their cold, go through the antenatal care, and if they're pregnant women who are going to have delivery, they go to a CMON facility and they know they can be cared. They wouldn't go to the tertiary hospitals. So you leave the tertiary hospitals for the sophisticated cases, whether oncological cases, immunological cases, cardiological cases, surgical cases that are very complicated, that needed expertise that is concentrated. And the training of the healthcare workers takes place in those places with support for the lower level. That is the idea of the integrated health system. That's the idea of the national health system. That is the idea of the Health Sector Renewal Investment Initiative and the compact that we signed, which brings the federal government, state and local government. And the referral system is implied, so that there's a referral system that can be activated. But when that is not fully in place, inevitably people will bypass the front line and they want to see the big doctor. And they all crowd in and they wait hours in teaching hospital to be treated for malaria. And that should not be the case ideally, but we're moving in that direction. In addition, there are other public health interventions that we are rolling out which can prevent even diseases. So when you see a severe malaria in an urban center, for instance, there's been a failure before then because some of these are preventable. If they use treated bed nets in their households, they clear water, early symptoms of fever, they go and get tested and they get treated with the right medication, then it shouldn't be complicated. But when you wait until it's late, then you get the complications. Same thing with diabetes or hypertension. If folks are screened early and they are treated, then they wouldn't have the complications of end-stage kidney disease because it's too late. So those preventative elements, the health promotion and wellness element, is also important. That is why our objective in the health sector under this president is to save lives, to reduce physical and financial pain, to produce health, and to do it for all Nigerians. That production of health is to ensure that we prevent diseases that can be prevented. And some of it is us to advocate, it's you in the media, but some also is behooves civil society, traditional leaders, religious leaders, and households to be responsible also for the health and well-being of their own families.
Well, I think
what they do also.
My apologies, Prof. I think the job of ensuring that we produce health is part of the reason why social welfare is also part of your responsibility, as Mopo asked you earlier. But allow me to draw your attention to something that is very important, but is rarely talked about. I'm looking at some numbers now that says that according to the National Blood Service Commission, the federal agency in charge of blood supply and all, Nigeria gets about 27% of its annual blood need from voluntary blood donors. That means we have a shortfall of about 73% plus of blood need every year. 60% of blood needs are consumed by maternal health and all of that. And about 20 to 25% of those numbers is what we usually get. Is there a plan around that? We are supposed to be getting some 1.8 million units of blood per annum. We're barely getting up to 30% of that. How have we managed over the years, Prof? I'm sure this is a concern for you because blood cannot be manufactured.
Yes, absolutely. And in fact, that is one of the focus that we have in 2025. We used 2024 to reposition the Blood Service Commission into an agency with a new leadership, and we were fortunate that a very distinguished Nigerian who is at Mayo Clinic in Jacksonville agreed to serve as the chair of the National Blood Service Agency. We're very privileged to have someone like Professor Abba Zubairu, who agreed to serve as the chair and the Director General of that institution, because he is well renowned in that field, to reposition the Blood Service Commission. And in 2025, the President put out a proposal to help strengthen the blood system, because yes, it's not satisfactory that we have that level. The culture of voluntary blood donation is not really well established. And even the blood donation centers, patients, women tend to depend on relatives, and others, when there is acute need of blood, it's not readily available. We need to increase that, and that's a focus of the Blood Service Agency with Professor Yuguda, who is there at the moment. But the safety of the blood system also, to ensure that the blood that is transfused is tested, well tested, with tests that can pick out infectious diseases that we don't want them to be transmitted to those who are being transfused. And there are other lines in the blood transfusion system, for instance, the white cells, platelets, and others for those who are oncological patients who are being treated for cancers. They require multiple blood infusions and also blood components. But for maternal mortality in particular, blood transfusion is important, but there are interventions that we are now gradually rolling out, which was tested and is very innovative. It's a postpartum hemorrhage drip, which a woman will be laid on, and when she's delivering, as she bleeds, the calibration of the drip will show the health worker how many mils of blood, so that it's more accurate than just the subjective opinion of the frontline of the worker that is delivering this woman. And at a critical threshold, they can intervene early before it's too late. And sometimes the interventions might include the stocking that will support her blood system, but also medications, that are oxytocics, that can be provided to stop the bleeding, and the referral if needed to manage the emergency complication and to ensure that she can afford it. That is the idea of the MAMI and the free treatment of obstetric complications that we've been announcing, we've been working on through the NHIA, so that we reduce the contribution of postpartum hemorrhage to maternal mortality. So there are many implications of lack of a functional blood system. And we are hoping, and we count on the National Assembly, that as the appropriation in 2025 is concluded, and based on the President's proposal, that they would support that appropriation, so that we have a robust blood transfusion system across the 6 geopolitical zones, and to begin to undertake things like drone delivery. In some countries like Rwanda, the drones that are delivering blood when needed from a centralized area, so that the logistics of getting the blood from where it's collected to where it's needed, when it's needed, is made easier, especially in remote areas or in insecure areas, so that we can save as many lives as we can.
Yeah, I'm particularly thrilled about the fact that at least there's a plan to increase the amount of blood.
Yes,
I hope you can hear me now. I'm particularly thrilled that, first of all, at least there is the plan to increase the blood supply before we can even talk about the ingenious idea of drone delivery and all of that. And you may also want to speak to why we have very low level of voluntary blood donation as opposed to the standard practice that the World Health Organization has been speaking about. But lastly from me, Prof, what are, and I know you've spoken about quite a number of things today, the challenges of funding are there, the infrastructural challenges are there, but what are your professional and maybe government health and social welfare goals for Nigeria for 2025? What are Nigerians to look out for from you and from your administration and your team?
First, the medical relief program, the Renewed Hope Medical Relief Program for Nigerians, to ensure that we do more in reducing the cost of pharmaceuticals, of consumables for Nigerians all over, the vulnerable Nigerians. And there is a proposal that the President announced as part of his 2025 budget, which, if appropriated, will provide relief to at least 10 million Nigerians directly in terms of cost of antihypertensive, to bring that relief more tangibly. Last year we did some, we've tested that. It's not yet enough. and we need to do more. That's one concrete one. The second is to continue to expand the functionality of the primary healthcare system through BHCPF, through the sector-wide program, the Health Sector Renewal Investment Initiative, so that the health workers, the primary healthcare system will function alongside the state, local government, and everyone. Thirdly, the infrastructural upgrades of our facilities, the cancer centers. In May, my hope is that we'll open the first 3, and then the other 3 will come afterwards, and the other major infrastructural upgrades will be concluded, and that NHIA will double up the number of Nigerians who are able to have insurance coverage, so that Nigerians afford that, and that if there are emergencies, outbreaks, the health security pillar of our agenda also is addressed, so that we don't have outbreak getting out of hand. Like the surveillance we're doing now for the human metapneumoviruses is being proactive. Like what we did with cholera, we tamped it down. Like with meningitis, when the season comes, with Lassa fever, so that we begin to do better at controlling outbreaks before they spread to be epidemics or before they become into pandemics, to have a robust system. And that the value chain that we have put as an agenda, we expand that we have many of those investments, whether it's bed nets, whether it's diagnostics, whether it's generic pharmaceuticals, begin to be produced in more numbers here, and our local manufacturers also have that to thrive. So those are the key things that I'm looking at, and for the health workers in Nigeria, to ensure that we continue to live in harmony and have peace to serve Nigerians, and that there are no strikes, and that whatever issues that exist, we're able to preempt them with the view that Nigerians are first, and whatever else we can deal with and negotiate around it. If we can do those 8 things, I believe that we'll have a very successful 2025 in line with the expectations of the president, that we should deliver a country that is healthy, that also ultimately is on its path to prosperity.
You managed to say all of these things without promising a salary increase to the health workers, which is essentially what they're looking for, Honorable Minister. Is that something that is really in the offing for them? Is that something you can look forward to this 2025?
I think there have been various conversations on this, and I know that it's not just about one thing. There are facets, and I believe that the president is looking at some steps that he's going to take, and we'll see in the next few weeks to months what transpires. But all in all, health workers are intrinsically motivated to serve, and they are not serving primarily because of money. The money is important, and they need to have a decent wage, and there are also other enablements that we are working to provide, so that they continue to serve our population.
For a number of people who are in the insurance system, the number of them complain about the quality of medicine that they get, and sometimes the level of service. I mean, sometimes it seems that those who are paying out of pocket get better attention and better service on time, and then sometimes the quality of drugs that are given to those on the how will I put it now, the insurance system, and this happens across board. It's not exactly, I'm trying to use my words very carefully now, but it's not really top-notch medicine, and a number of people have complained. Do we have, an eye on the quality of medicines that are dispensed within the Nigerian healthcare system?
NAFDAC is a principal regulator, and if you look at their data, they're reporting, there's been a gradual reduction in substandard counterfeit medicines that are in this country. But part of the issue is at the borders, people can bypass some of those mechanisms, but those are being addressed. The other issue, which I think the executive order, which I think the earlier commentator at the very beginning of the program mentioned that yes, it's been done, it's been signed, it's been gazetted. The implementation framework, I think is on the way, and Customs owns it, Ministry of Finance owns it, to ensure that we provide the relief for the good medicines to come in, good raw materials, equipment, and to have those incentives function, while at the same time keeping away those unregistered or counterfeit things. And within the country, for NAFDAC to do better in terms of surveillance of the distribution system, and the Pharmaceutical Council We're working with them to strengthen the distribution through the outlets because they're the regulators of that. Now, NHIA as a purchaser has a responsibility in terms of how it reimburses providers. And it did some steps in 2024. It increased the tariffs, in fact, twice. So that increase, it's at least an improvement from where they were before. May not be all that the providers may need, but it's also a function of the premium because you cannot insure someone in abstract. If I insure you, somebody must have paid the premium. So who is paying the premium? If the public sector puts resources at NHIA, then NHIA can insure more people. If the employers put more people, or if individuals pay the premium for themselves, then they get insured. But you cannot just insure by prescription. I prescribe that you are insured. So as the NHIA gets more resources, then it can up and improve the purchasing function that it plays. And the rigor with which it sanctions if there are discrimination, let's say, against those who are being served through it. But there are many facets of this, and we see with our efforts to domestically manufacture and to improve the regulatory capacities that over time that Nigerians can be assured. For us, there's zero tolerance. We want to assure that there is safety and there's efficacy in the commodities that Nigerians are accessing in the healthcare system. There are bad actors that may choose to go across the border, and they are Nigerians. So if Nigerians know them, call them out, report them to the authorities, and so that we can deal with them.
Honorable Minister, I would like to thank you for your time with us this morning. We're totally out of time. Thank you so much for coming on Sunrise Daily. Professor Ali Pate is the Coordinating Minister for Health and Social Welfare. And just a little reminder from your friend in Ososa who's watching this program, reminding you of a promise you made to his community a year ago. Please, Honorable Minister, kindly reach out. Thank you so much for coming on Sunrise Daily this morning. Well, it's a little past the hour now, but I do know that Business Morning on Sunrise Daily is on standby. Please don't go anywhere.